If you have ever been a young father with a baby with a serious medical problem and you had no health insurance, you'll never forget it as long as you live. I know, I've been there. The notion of losing your health insurance leaves you as vulnerable as possible in some of the most important moments of your life. And that they would consider this provision to eliminate health insurance coverage for 16 million families is unimaginable and cruel. Let's not act like there is a unified Republican front on this issue. Even some of my colleagues on the other side of the aisle don't want to be here at this moment, jamming this unpopular bill through this chamber under arbitrary deadlines. One of my colleagues took a look at tax breaks, and you're going to hear them say over and over again, well, the average family, if we don't act, the average family is going to have to pay more in taxes. There's a way around that. If we limit any tax breaks in this bill, in this effort, to people making $400,000 a year or less, $400,000 a year or less, it virtually eliminates 2/3 of the cost of this undertaking. And it means you don't have to take away the health insurance of 16 million families. So there are ways to do tax breaks which make sense. Count this Democrat in with the Republicans for helping working families who are struggling to get by, and a lot of them are, living paycheck to paycheck. And the notion that we would say to them, we're going to take away your health insurance, we're going to raise the cost of health insurance for you, is no answer to their problems. Behind closed doors, my Republican colleagues continue to be consumed with infighting, bickering over the bill's substance, and for good reason. We have a process here which is almost impossible to explain to an ordinary person of how we reach reconciliation. The parliamentarian's office, and she's sitting here, God bless you for what you've been through for the last several months, and all your staff, have to make decisions on a daily basis over and over again as to whether or not provisions of this bill are eligible under the law that governs the United States Senate. We're in the process of debating this on the Senate floor. I see our ranking member on the Budget Committee, Senate Budget Committee, the senator from Oregon. We're in the process of still appealing to the parliamentarian's office on provisions in the bill. This is truly a work in progress. I think what they do know is troubling, and it should be. This bill would be a disaster for hospitals. The Senate Republican bill, unfortunately, is going to endanger hospitals all over the United States. But if you happen to live in a small town, rural area, and I represent a lot of them in the state of Illinois, you're the most vulnerable. You are the target. When they cut back on Medicaid programs, these are the hospitals that will close their doors. What's the impact of a hospital closing its door in a downstate community in Illinois? Devastating. Hospitals are not only the center for emergency medical care, good doctors, nurses, and such, they are also a major economic force in small town America. Take away a hospital and then try to attract a new business to your community. Good luck. This Senate bill cripples one of the main ways that states fund their Medicaid programs and keep hospitals afloat, especially rural and low-income areas. It's called the provider tax. Earlier this week, a Republican senator circulated a flyer to his fellow caucus members, so they're all on notice, detailing just how much each state will lose in Medicaid provider tax funding under their proposal. Let's take a look at my neck of the woods, the Midwest. Iowa would lose $4.1 billion. Missouri, $6.1 billion. Kentucky, $12 billion. Louisiana would lose $20 billion. North Carolina, $38.9 billion. Senator Tillis and I were in conversation yesterday, and he used that very same figure. His analysis says that to go forward with this bill cuts Medicaid reimbursement in his home state of North Carolina by a whopping $38.9 billion. This list of states and what they will lose was passed around by a Republican senator to his own caucus. They know what they're up against here. If Republicans have their way and pass this bill, hospitals will be forced to shrink or eliminate services. In Decatur, Illinois, one of the major hospitals facing the crunch time had to make a decision whether they keep their doors open. They did, but they eliminated OBGYN, delivering babies, and they eliminated all mental health and addiction counseling, two critical areas for the hospitals. So these doctors, this bill will force hospitals to shrink or eliminate services. Doctors and nurses will leave, and in some cases, the hospital will close. Imagine that in a rural area, a remote area, an extra 45 minutes, an extra hour in the car with somebody in the front seat you love very much who's in a desperate situation. As it stands today, half of the rural hospitals around the country already operate in a danger zone. And it's the same thing for children's hospitals. Do you have one in your community that you've used? I do. These children's hospitals have warned us they can't keep their doors open if Medicaid is cut as dramatically as the Republicans want to cut it. If Republicans have their way, we're going to see massive layoffs, fewer nurses, technicians, and doctors, along with decreasing quality of care. The American Hospital Association has estimated how these cuts to Medicaid could impact not just jobs at red state hospitals, but across the entire economy. Here's what they found. If the Republican provision goes through that cuts Medicaid reimbursement in order to provide tax breaks for wealthy people, Maine, as an example, one state, would lose 5,000 jobs. Kansas, 6,200 jobs. Iowa, 11,000 jobs. Missouri, 26,600 jobs. I've talked to the administrator of BJC in St. Louis, Missouri. The reason is it's not just a Missouri hospital. They have their facilities on the Illinois side of the river. In fact, 1/3 of their patients are from Illinois, and 1/3 of their patients overall use Medicaid to go to their hospital. So he's told me what's going to happen if the Republican measure goes through and the cutbacks to these hospitals. They came up with, incidentally, the rescue fund to solve the political problem. I want to check to make sure Senator Murray can back me up on this. Our overall cut in Medicaid now is at about $1 trillion. Correct. $1 trillion. Imagine, this is Washington, we talk in those terms. Cutting Medicaid nationwide $1 trillion. And the rescue plan for the small hospitals that are in danger, the ones I've talked about, $1 trillion cut. How big's the rescue plan? $25 billion. Do the math. It's a joke. It is a joke. If Republican leaders think this is an adequate amount to alleviate pain all of our nation's rural hospitals are going to feel, then that's like trying to put out a forest fire with a garden hose. This simply won't work. I want to conclude by saying this. We passed the Affordable Care Act 15 years ago. Of all the things that I've worked on in Congress, I think it had more positive impact to help the families across America than anything. We found a way to make health insurance more affordable for families 15 years ago. And to do it, we held hearings, 100 hearings on the Affordable Care Act. Obamacare is what they called it. Roundtables, walkthroughs. 2 committees spent a combined 21 days holding markups so that everyone could offer an amendment. Do you know how many amendments were made to the Obamacare program? 400. 400 votes in committee and on the floor on amendments. 147 Republican amendments were included, though not a single Republican senator ended up supporting Obamacare when it was all over. What do we have here with this measure? At the end of the day, that legislation, the Obamacare, allowed more than 40 million Americans to gain health insurance. Today, how many hearings have we had on the bill that's before us, this dramatic multi-trillion-dollar bill? None. Zero. Not a single one. Zero markups for senators to offer amendments. 400 amendments on Obamacare. None on this one until it comes to the floor today. Zero bipartisan input. Our friends on the Republican side have said basically, it's a big deal. Take it or leave it. Should this bill become law, do you know what we'll done? Thrown 16 million Americans off health insurance and closed many vulnerable small hospitals, all to pay for tax breaks for millionaires and billionaires. Maybe some of my Republicans are okay with that. I don't think the American people are. I'm hoping that sanity and common sense prevail. We need 4. We need 4 senators to step up and say, stop this train. We've got to sit down and do our homework. We cannot expose the American families and the American economy to do this in the name of preserving tax breaks for the wealthiest people. Elon Musk seems to be doing okay in life, right? The wealthiest man in the world. Do you know what the tax break is for Elon Musk on the bill that's before us on the floor? $346,000, a lot of money. To him, he won't even notice it. Giving him a tax break, he won't notice, and taking away health insurance from families who will be devastated, 16 million around the country. It's an important choice, and it's one we should make the right one. I yield the floor.
Mr. President.
I recognize the senator from Kentucky.
In deciding whether to vote for the big, not-so-beautiful bill, I've asked a very specific question. Will the deficit be more or less next year? The answer, without question, is this bill will grow the deficit. The federal government has fancy formulas and hundreds of wonky accountants who inform us of their projections over 10 years. But you often can't trust these projections. In an excellent piece written by the Foundation for Economics and Education entitled "The CBO